coming up.
Madam Speaker, this is not a dispassionate expert. This is someone who went from the public health world into selling heroin. 12 meetings in 2 years is not normal even for an expert. Again, I'll ask, what is being discussed in these meetings? What is Fair Price Pharma asking this Liberal government for?
Has the minister taken any action to mitigate government-funded drugs being diverted into the black market?
Madam Speaker, why does this NDP Liberal coalition government value the lives and rights of people who use hard drugs in public over the safety and rights of law-abiding citizens?
Can the minister tell us who is paying for these drugs?
Mr. How many nurses reported being physically assaulted last year?
The Honourable Minister.
This guy's garage. Like and subscribe.
Resuming debate, the Honourable Member for Sherwood Park, Fort Saskatchewan.
I'm splitting three ways, and my questions will be for the Minister of Mental Health and Addictions. My colleagues have asked about a company called Fair Price Pharma, run by former BC Public Health Officer Perry Kendall and a partner. Their business is selling heroin. The results of an order paper question show that in a 2-year period leading up to December 13th of last year, the Minister met with Fair Price Pharma on September 15th, and her predecessor met personally with Fair Price Pharma 4 times, and that health officials met with them an additional 7 times. That is a dozen meetings in 2 years, a lot of meetings for a minister and officials with one company that's in the heroin business. What is being discussed in these 12 meetings between Liberals and this heroin company?
The Honourable Minister.
Thank you, Madam Chair. And just to be clear, I, as Minister of Mental Health and Addictions, have not met with Fair Price Pharma. And the September 15th meeting that the member is referencing was actually a meeting of ISET, with another office and not my department. There were members of my staff who were present at that meeting, invited to listen in. But just to be clear, we meet with experts in this field. Dr. Kendall was joined by Dr. Schefter and other experts at those meetings, and we need to talk to experts, even if we don't agree with them, Madam Chair.
The Honourable Member for Sherwood Park, Fort Saskatchewan.
Madam Speaker, this is not a dispassionate expert. This is someone who went from the public health world into selling heroin. 12 meetings in 2 years is not normal even for an expert. Again, I'll ask, what is being discussed in these meetings? What is Fair Price Pharma asking this Liberal government for?
The Honourable Minister.
The Dr. Kendall that the member is referencing was part of the BC government, not the federal government, just to be clear. And as I mentioned before, those meetings that were held at ISET, I did not attend those meetings and was not privy to the discussions around the table. We talked to
The Honourable Member for Sherwood Park, Fort Saskatchewan.
12 meetings in 2 years. 4 in-person meetings with this heroin company and the former minister. And this new incoming minister must have been briefed on what the nature of this close relationship was and what was being discussed. For a final time, why is this government meeting 12 times in 2 years with this heroin company? What is being discussed? What is Fair Price Pharma asking for?
The Honourable Minister.
Madam Chair, the member across the way knows perfectly well the meetings were held at ISET. The member also knows that I have not met with Fair Price Pharma. The member also knows that my predecessor did meet with Fair Price Pharma. That being said, what I do know is across the way they do not listen to many of the experts we need to listen to, including Mom Stop the Harm. I'd love to know why the Leader of Opposition refuses to meet with families who know what they need in their communities. We will meet with everyone. Why don't they?
For Sherwood Park, Fort Saskatchewan.
Madam Speaker, a lot of people want to hide their meetings with drug dealers, but I would have expected better from this minister. What is the purpose of these 12 meetings with these corporate drug dealers?
Honourable Minister.
Madam Chair, I've answered this question already. He can keep asking it, but we will speak to all experts on what matters, and most importantly, to save lives, all tools and resources.
For Sherwood Park, Fort Saskatchewan.
Is the Government of Canada party to any contracts or agreements involving Fair Price Pharma?
The Honourable Minister.
No.
Honourable Member for Sherwood Park, Fort Saskatchewan.
Will the minister demonstrate her point either way by releasing all contracts involved in safe supply?
Pharmaceutical contracts are the purview, excuse me, Madam Chair, of the provinces in terms of prescribed alternatives.
The honourable member for Sherwood Park, Saskatchewan.
We put forward a motion to the Government Operations Committee asking for any contracts to which the federal government is a party. Liberals have been filibustering to block the release of those contracts. If no contracts existed, I suspect Liberals wouldn't be motivated to filibuster to block their release. Will the minister agree to release any contracts to which the federal government is a party involving these drug programs?
The honourable minister.
Madam Chair, federal funding towards prescribed alternative programs goes to the operations of the programs themselves. As I've said, contracts with pharmaceutical companies for prescribed medications are between the province and those pharmaceutical companies. We support implementation of programs.
Honourable member for Sherwood Park, Saskatchewan.
There have been 12 meetings with a heroin selling company. This government is refusing to release contracts involving the Government of Canada and corporate drug dealers. Why won't the minister tell us what was discussed in those meetings, and why is the minister sitting on these contracts?
The honourable minister.
As I've stated, but I will repeat for the benefit of the committee, Madam Chair, contracts such as these are between provinces and these companies, but just to clarify, costs go to
keep going.
medication.
Perfect. The honourable member for Kelowna Lake Country.
My questions are for the Minister of Mental Health and Addiction. The Minister's Department approved of an open drug use policy in public places, including parks and playgrounds in British Columbia in 2023. Does the Minister believe children seeing drug usage normalizes drug usage for children?
The honourable minister.
Madam Chair, we're committed to a compassionate approach to this public health crisis that is clearly anchored in public safety as well. But we need to understand that those who use drugs need to be directed to health care. Families and communities have a right to be safe wherever they are, parks, beaches.
The honourable member for Kelowna Lake Country.
Does the Minister believe illicit drug supplies left in parks and playgrounds increases the risk of accidental overdoses of minors?
The honourable minister.
We are moving through this public health crisis with a strict lens on public safety and public health, and we will work with jurisdictions.
Honourable member for Kelowna Lake Country.
The Minister has confirmed tonight that the leading cause of death of children and teens, sadly, in British Columbia in 2023 is illicit drug toxicity, correct?
The honourable minister.
Yes, the toxic drug supply is costing us many lives in many communities, and it is absolutely tragic.
Honourable member for Kelowna Lake Country.
In Campbell River, a major drug seizure was reported in February 2024 having hydromorphone pills with evidence suggesting they were diverted from government-funded supply. Did the Minister ask for a briefing on this?
The honourable minister.
As I've stated before, both in the House and in this committee, the RCMP, based on the most recent data, has shown that there has been no increase in hydromorphone diversion in Canada over the last decade.
Honourable for Kelowna Lake Country.
Is the Minister concerned about diversion of government-funded drugs like this to children?
Honourable minister.
I think we're all concerned about diversion because it is illegal.
Member for Kelowna Lake Country.
Is the Minister aware that the drug seizure in Campbell River had fentanyl powder molded into the shape of gummy bears and dinosaurs?
The honourable minister.
All diversion is illegal, Madam Chair, and extremely concerning. This is why law enforcement is a key pillar of our strategy.
Honourable member for Kelowna Lake Country.
Does the Minister not think these were targeting children?
The honourable minister.
All diversion is illegal, and we are concerned for all our children.
The honourable member for Kelowna Lake Country.
Is the Minister taking action to stop these drugs from getting into the hands of children?
The honourable minister.
We continue to work with law enforcement and jurisdictions to ensure that diversion is mitigated.
Honourable member for Kelowna Lake Country.
Has the Minister given any directives at all to stop these illicit drugs from getting into the hands of children?
The honourable minister.
We are working closely with public safety and criminal justice partners to ensure that diversion is mitigated.
The honourable member for Kelowna Lake Country.
I think we should take that as a no. September 2023, the Minister received a letter from 17 addiction medicine doctors who said, quote, "We are regularly seeing and hearing in our practices that diverted hydromorphone is causing harm to both adults and children." Does the Minister agree with their statements?
The honourable minister.
I have met I've both met and received letters from experts on their concerns, and this is why we have listened to them and heard them and taken their advice, and also listened to other experts to ensure that we create programs with jurisdictions that are safe.
Kelowna Lake Country.
Has the minister implemented any of the recommendations from the letter that I referenced?
The Honourable Minister.
Health Canada has worked with prescribed alternative programs to ensure that protections are in place.
Kelowna Lake Country.
Has the minister taken any action to mitigate government-funded drugs being diverted into the black market?
The Honourable Minister.
That is the role of law enforcement, Madam Speaker.
The Honourable Member for Kelowna Lake Country.
Has the minister taken any action to mitigate government-funded drugs from getting into the hands of children and teens?
The Honourable Minister.
The government funds programs, provinces have contracts for the medications.
The Honourable Member for Kelowna Lake Country.
Government-funded drug policy protocols allow for prescribed fentanyl to minors without parental knowledge in BC. Does the minister support this?
The Honourable Minister.
To be clear, no child in BC has been prescribed fentanyl. That being said, I'll leave it there.
The Honourable Member for Kelowna Lake Country.
Does the minister believe that there should be a minimum age for when youth can receive recreational fentanyl?
The Honourable Minister.
Madam Chair, no one should be receiving recreational fentanyl.
The Honourable Member.
Does the minister believe that parental agreement should be required before their child is prescribed a dangerous drug like fentanyl?
The Honourable Minister.
As the member well knows, the relationship between a physician and their patient is a sacred one.
Kelowna Lake Country. Oh, Member Kelowna Lake Country. There's time is up. The Honourable Member for Souris Moose Mountain.
Madam Speaker, and all my questions will be for the Minister of Mental Health and Addictions. Madam Speaker, why did the minister tell law enforcement that they are expected to, quote, do their job when the NDP Liberals took away their ability to keep our communities safe from people using hard drugs in public?
The Honourable Minister.
The member well knows that law enforcement falls under provincial jurisdiction. They also have the purview to enforce bylaws and best practices for law enforcement to keep communities safe.
The Honourable Member for Souris Moose Mountain.
The Deputy Chief of Vancouver Police stated on April 15th that their members required, quote, tools so they would be able to do their jobs when there are community concerns about problematic drug use. Madam Speaker, what resources did the minister give the law enforcement before deciding to legalize the use of hard drugs?
The Honourable Minister.
Madam Speaker, this is why we made amendments to the BC exemption recently, and with the understanding that law enforcement would be given clear direction on how to address public use.
The Honourable Member for Souris Moose Mountain.
The answer is none. Did the minister provide funding?
The Honourable Minister.
Law enforcement is under the jurisdiction of the province.
Member.
Why did the minister not provide funding?
The Honourable Minister.
Law enforcement is under the jurisdiction of the province.
The Honourable Member.
Did the minister provide any training?
Honourable Minister.
Law enforcement is a provincial matter.
Honourable Member.
Did the minister give them anything whatsoever to help them keep Canadians safe?
The Honourable Minister.
Law enforcement is provincial jurisdiction.
Honourable Member.
Madam Speaker, why does this NDP Liberal coalition government value the lives and rights of people who use hard drugs in public over the safety and rights of law-abiding citizens?
The Honourable Minister.
Why do the Conservatives pit harm reduction against treatment and instead not to choose a comprehensive and evidence-based, compassionate approach to address the overdose crisis and to help those who need help?
Honourable Member.
Another non-answer. If the minister was at a beach with her family and someone lit up a crack pipe beside them, that would be totally fine since that is their right. Is that correct?
The Honourable Minister.
The amendment entailed directing for public health and public safety in terms of public spaces.
Honourable Member.
What about injecting heroin with your children at the playground?
The Honourable Minister.
Again, the exemption allowed for releasing decriminalization in public spaces.
Honourable Member.
Is it acceptable for youth to be directly exposed to people getting high on hard drugs?
Mind the member, he's to address questions and comments through the chair, not directly to the minister. The Honourable Minister.
Madam Chair, we want to protect our youth.
The Honourable Member.
Madam Speaker, does the minister believe that recovery from addiction is always possible?
The Honourable Member.
It may take many pathways to get to recovery, Madam Chair. That's why comprehensive approaches.
The Honourable Member.
Is the minister satisfied with the current availability of drug rehabilitation and/or treatment programs?
The Honourable Minister.
Those would be health services, Madam Chair, which fall under the jurisdiction of provincial health services. We will always support them.
The Honourable Member has 1 minute.
The NDP Liberal government has spent over $100 million to date on so-called safe supply. How much are you spending on beds in recovery centres?
The Honourable Members to address. The Honourable Minister.
Over $200 billion in healthcare agreements include mental health and substance use supports. Madam Chair, I would ask him to ask each jurisdiction how much they're spending.
Member.
Again, Madam Speaker, how many beds would $100 million have bought?
The Honourable Member. Minister.
That would be the purview of health services of the province, Madam Chair. I encourage him to ask his local jurisdiction.
Honourable Member. 16 seconds.
Madam Speaker, has the minister heard the statement from the RCMP that nearly 2/3 of their detachments serve communities that do not have drug rehabilitation or treatment programs available?
Honourable Minister.
Mental health services are part of the $200 billion in bilateral agreements, Madam Chair, and over 30% of those agreements are dedicated to mental health and substance use.
Resuming debate, the Honourable Member, l'Honourable Député de Mégantic-Clairable.
The Honourable Member for Mégantic-Clairable. Thank you, Madam Speaker. I'll be sharing my time with two of my colleagues. My question is for the Minister responsible for mental health and addiction. After the catastrophic failure of the legalization of hard drugs in BC, will the Minister now admit that this pilot project was unfortunately a fatal mistake? The Honourable Minister.
Just to correct the member, Madam Speaker, decriminalization is about possession, and it is not the legalization of illicit drugs.
The Honourable Député.
The Honourable Member. In spite of the words, was that pilot project unfortunately a fatal mistake, and will she admit that mistake? The Honourable Minister.
The pilot continues, Madam Chair. I'm happy to inform the member with the amendments requested.
The Honourable Member. Can the Minister tell us how many people have died as a result of the legalization of small quantities of hard drugs? The Honourable Minister.
The numbers for the past year were about 2,500 in the province of BC from the toxic drug supply ban.
The Honourable Member. Is the Minister aware that the City of Montreal is planning to call on the federal government to legalize simple possession of hard drugs? The Honourable Minister.
We have received no such proposal from the City of Montreal, but we work with provincial and municipal jurisdictions.
The Honourable Member. Does the Minister intend to grant Montreal City Council's request? The Honourable Minister.
As I've said before, Madam Chair, we don't deal in hypotheticals. We deal in evidence and facts and actual proposals.
The Honourable Member. I have here the City of Montreal's resolution. Is the Minister aware that the Mayor of Montreal personally repeated her support for the legalization of hard drugs in 2023? The Honourable Minister.
I'm sure the Mayor of Montreal has made many statements, and the City Council is allowed to pass whatever resolutions it wishes, but at this time there is no proposal in front of Health Canada.
The Honourable Member. Does the Minister intend, yes or no, to grant Montreal's request and to import to Quebec the disaster that was created in BC?
There is no request, Madam Chair. We do not deal in hypotheticals. We deal with evidence and facts on this side of the House.
The Honourable Member. Does the Minister intend to say yes or no should Montreal request an exemption and allow this kind of pilot project in Quebec? The Honourable Minister.
Does the member have a crystal ball that he can anticipate that there will be a proposal in front of the department for me to contemplate that question? I don't see one. Therefore,
I do want to remind other members they're not to participate unless they have the floor. L'honorable député.
The Honourable Member. Is the Minister aware of the criminal trafficking in legal drugs provided free of charge to hard drug users? The Honourable Minister.
To my knowledge, that is an odd question, Madam Chair.
L'honorable député.
The Honourable Member. I'll repeat. Is the Minister aware of the criminal trafficking in legal drugs provided free of charge to hard drug users? The Honourable Minister.
If the member is referring to diversion, then he well knows that diversion is illegal, Madam Chair.
L'honorable.
The Honourable Member, a minute and 11 seconds. Can the Minister tell us who is paying for these drugs?
L'honorable.
The Honourable Minister. The Honourable Member, is the Minister aware of the crack alley in Montreal? The Honourable Minister.
I'm sure there are many communities with drug use issues.
L'honorable député.
The Honourable Member. The Minister says she is responsible for mental health and addictions. Has she ever been to Montreal to see with her own eyes how bad the disaster is with the use of hard drugs? The Honourable Minister.
I have been to Montreal, Madam Chair, and to many communities across the country that are struggling with the drug overdose crisis.
L'honorable député.
The Honourable Member. Well, how is it possible that the Minister cannot say no to possibly decriminalizing hard drugs in Montreal? Because according to TVA Nouvelle, there is psychosis, there is use of crack and crystal meth. This is omnipresent and it's almost become normal. Let's allow the Minister to answer.
Just so that we're clear, the Montreal Mayor has said that such hypothetical allegations of a proposal for decriminalization is false.
The Honourable Member. The Honourable Member knows full well that if he wishes to ask more questions, he needs to wait for an answer.
For Caribou Prince George, resuming debate.
Thank you. To the Minister of Mental Health and Addictions. Minister, how many nurses reported being physically assaulted last year?
The Honourable Minister.
That would be provincial data, Madam Chair, with regards to their health workers force.
The Honourable Member.
61%. How many paramedics and firefighters have experienced workplace violence?
The Honourable Minister.
Again, that is data that is under provincial purview to engage with and address.
The Honourable Member for Caribou Prince George.
84%. How many healthcare workers reported mental health issues last year?
The Honourable Minister.
That is why we have created a nurse's toolkit for mental health, Madam Chair.
Honourable Member.
92%. Almost 50% of those were assaulted 11 times or more. How many nurses considered leaving their jobs?
Honourable Minister.
We know that health workforce retention is an issue across the country, Madam Chair, due to burnout and other issues of
The Honourable Member.
2/3. Does the Minister think violence in the workplace is acceptable?
The Honourable Minister.
Past legislation is such that it's unacceptable, Madam Chair, and no.
The Honourable Minister. Member.
Has the Minister read the recommendations of the 2019 HESA report on violence facing healthcare workers in Canada?
The Honourable Minister.
I have some time ago, Madam Chair, but as he would well know, my colleague, the Minister of Health, would be addressing workforce safety.
The Honourable Member.
Does the Minister know how many of the recommendations have been acted on by our government?
The Honourable Minister.
That would be an appropriate question for my colleague, the Minister of Health, who addresses healthcare work.
The Honourable Member.
Has the government targeted any funding for workplace violence prevention with healthcare?
The Honourable Minister.
That would be under provincial jurisdiction, Madam Chair, as the member well knows, but we are all encouraging safety in all workplaces.
The Honourable Member.
Is the Minister aware that my Bill C-321 is a direct result of the 2019 HESA recommendations on workplace violence?
The Honourable Minister.
I am aware.
Can the Minister tell the House how many days it's been since C-321 was unanimously passed by the House of Commons?
The Honourable Minister.
No, I am not aware, Madam Chair.
The Honourable Member.
1 day. Why is the government blocking passage of my bill in the Senate?
The Honourable Minister.
The Senate is independent, Madam Chair. The other place has its own rules and timelines.
Can the Minister tell what she has done to ensure that C-321 passes the Senate quickly?
I have a point of order. The Honourable Member for Kingston and the Islands.
I completely appreciate that there's latitude to go beyond the scope of perhaps the estimates a bit, but we're not even talking about the estimates now. Now we're talking about an individual private member's bill. The last 3 or 4 questions have been on this. This is a debate about the estimates with this particular department.
So I think part of that is actually a debate, but I do want to remind the member that he's to address the questions and comments through the chair to the member relative to the matter that is before the House. The Honourable Member for Cariboo Prince George. 2 minutes.
Madam Speaker, my bill will make it an aggravating factor during sentencing if the victim of assault is a nurse or a first responder. Can the Minister tell this House what actions she can take to pass Bill C-321 today, tomorrow, or any time?
The Honourable Minister.
It's unfortunate that the member isn't familiar with the civics and processes of this place, because the Senate is independent, Madam Chair, and therefore they work on their timelines and their decision-making process. I'm sure they're having a robust debate on the bill.
I want to remind the member that the questions are to be with respect to the estimates, and so I just want him to ensure that his questions are pertaining to the estimates. The Honourable Member for Cariboo Prince George.
Madam Chair, on that with response, I did ask how much money was in Budget 2024 with respect to violence in the workplace.
To ensure that the conversation didn't, that your response wasn't going to be affected by the time. You have 1 minute and 11 seconds left.
Minister of Health, the C-64 provide for government-funded heart medications?
The Honourable Minister of Health.
No.
The Honourable Member.
To the Minister of Health, does C-64 provide for government-funded ALS medications?
The Honourable Minister.
To the Minister of Health, does the C-64 provide for government-funded asthma medications?
No.
The Honourable Minister. I just want to remind the Honourable Minister to wait until I recognize him so that we can give time for the light to come on and his answer can be heard. The Honourable Member.
To the Minister of Health, does C-64 provide for any other funding or government funding for any other rare diseases?
The Honourable Minister.
Action for drugs for rare diseases are under a separate action, and that money is available. $1.5 billion will be signed.
The Honourable Member.
The question was regarding C-64. Can the Minister of Health tell if C-64 provides for any other government funding for any other ailments other than diabetes?
The Honourable Member is out of time, but I'll allow the Honourable Minister to respond.
The intention of the bill is for diabetes and for contraception.
The Honourable Member for Mission Matsky Fraser Canyon resuming debate.
As a father of 3, I emphasize with many parents who worry about drugs. For instance, the Abbotsford Soccer Association decried in an open letter several safety issues related to drug paraphernalia, overdoses, vandalism, even rape at public fields. Does the Minister agree it is unacceptable for parents and coaches to have to sweep soccer fields for drug paraphernalia before the start of every game and practice?
The Honourable Minister.
Madam Speaker, as a parent myself, I will say we're always concerned about public health and public safety for our children, our families, and our communities, but we've committed to a public health approach that is compassionate with a firm lens on public safety as well, Madam Speaker. This is the work that we do comprehensively with all jurisdictions across the country.
The Honourable Member.
what action should parents take when they're exposed to drug paraphernalia at playgrounds and fields? Has the minister provided Canadians with a toolkit to deal with such situations?
The Honourable Minister.
Such actions would be under the bylaws and purview of local communities, municipalities, and jurisdictions. However, we have the No Opioids Education Program, which clearly addresses that.
Honourable Member.
What would the minister say to parents who don't want to take their kids to parks, playgrounds, or the beach for fear of exposure to dirty needles?
The Honourable Minister.
Madam Speaker, of course this is unacceptable, and I lament the member to not stigmatize this, but talk about how we save lives.
The Honourable Member.
Does the minister agree that it is important to put up warning signs on beaches for fear of exposure?
The Honourable Minister.
That would be for local municipalities or provincial jurisdictions to determine how they want to add that as a layer of enforcement.
The Honourable Member.
Before decriminalization was implemented in BC, did the Department of Health conduct any studies on the impact of public drug use on children? If so, can she please provide such information to the House?
The Honourable Minister.
Madam Speaker, decriminalization as a tool is one that's well used in many jurisdictions across.
The Honourable Member.
I will take that as a no. When the minister decided to rescind the open drug use policy, was it because she heard, like me, that children were being exposed to hard drugs at schools and in parks?
The Honourable Minister.
Madam Chair, BC requested an amendment to their exemption, and we worked with them, as we always have, and will continue to do, to ensure that there's a balance between public health and public safety in all spaces.
Honourable Member.
Did the minister's decision account for open and brazen use of drugs on BC's public transit system?
The Honourable Member. Minister, sorry.
Thank you, Madam Chair. BC's application was prepared with a myriad of experts in many, many fields, including chiefs of police, health experts, and public safety experts, and this is the work that we need to do collaboratively to address
the Honourable Member.
Given that drug toxicity is the leading cause of death for children 10 to 18, should school teachers, parents be trained on how to deal with overdoses?
Minister.
I'm happy to talk about the No Opioids program, Madam Chair, which is what we've implemented in schools across this country and continue to do to help inform and educate.
Honourable Member.
At the Mission Legion, veterans clean up needles and confront crack smoking daily. Do veterans and Legion volunteers need to be trained on overdose scenarios and public safety to keep their property safe and protect life?
The Honourable Minister.
To talk about the training and distribution of naloxone kits that we've done across the country for many communities and institutions. 1.5 million naloxone kits have been distributed by the federal government, and even more so through our provincial cooperation.
The Honourable Member has 54 seconds.
Businesses across the province have reported deteriorating public safety. The Surrey Board of Trade called it a crime tax. Does the minister agree with the Surrey Board of Trade that decriminalization is effectively a crime tax on small businesses?
The Honourable Minister.
Madam Chair, we will address this overdose crisis with every tool we have available because communities are asking us to do so. I would encourage the member to speak to his community, to speak to local law enforcement, and also to his local provincial jurisdiction on what works.
The Honourable Member has 19 seconds.
I would encourage the minister to visit the Abbotsford Soccer Association and address the fear that parents have due to the loss of public order caused by this government's policy. Will the minister meet with the Abbotsford Soccer Association?
We're out of time. The Honourable Minister can respond.
Madam Speaker, we have met with many communities. Will the Leader of the Opposition meet with Moms Stop the Harm?